வேதான் சேனல்.
வாழ்க வையகம் வாழ்க வையகம் வாழ்க வளமுடன். குரு வாழ்க, குருவே துணை.
Today we are going to see about the topic as fetal circulation. And that if you are saying that the human body is contained the two types of blood circulations. In the blood circulation is having two types in the for human body as well as to the fetus also. If you are seeing that the human body blood circulation is pulmonary circulation and systemic circulation. Pulmonary circulation means that is the circulation between occur in the heart and lungs. That circulation is the pulmonary circulation. And next, systemic circulation means that circulation it's occur from that heart to all the system circulations. If suppose in this renal system, cardiovascular system, respiratory system, in the system all the system blood supply occur in that body. So from the body that impure blood receive to that enter into the heart, and again that pure blood it's from the heart it supply the all system. So this is a systemic circulation. And like that will be present in that fetus also. Hence the fetus also contain two types of circulations. They are placental circulation and fetal circulation. In fetus also it's having the two types, that is the placental circulation and fetal circulations. Now we'll see that fetal circulations. Laterly we will see that placental circulation. We're seeing the fetal circulations. Fetal circulation starts from placenta to fetal parts, then the blood returns to the placenta. Fetal circulation means that circulations will occur in the placenta to fetus, fetus to placenta. That is the fetal circulations. And through it will be started that through the umbilical vein the fetus receive all the necessary nutrition, oxygen and life supporting things from the mothers. Through that from the placenta, that through the umbilical vein the fetus receive all the necessary nutrition, oxygen and life supporting things from the mothers. All the nutritions and nutritious blood it will be present in the placenta. From the placenta only through the umbilical vein that all the nutrition is received to the fetus. And next, fetal circulations differs from adult circulations such as route of blood circulation, content of organs, carrying capacity, source of oxygen and structure of organs. All the things it will be different from the adult circulation. So now we'll see that there's a placenta. It's a process how it will be occur in the blood circulations in the placenta. What work will be doing that in the human body heart, and what work it's doing the heart, and that same work is doing the placenta and the fetus. The placenta it's getting the blood from the uterine arteries from the mothers. So in this placenta it's getting all nutritious and oxygenated blood, and next it will be transmitted to the umbilical vein. Through the umbilical vein it will be entered into the fetus umbilicus, and next after entering the fetal umbilicus it will be entered into the falciform ligamentum of the liver. So this after entering the fetus umbilicus, the falciform ligament is present in the liver. In that part will be entered into that blood vessels. Through that blood vessels the blood will be entered in that part, and next it will be reaches to the liver. When we enter that blood in the liver, that time deoxygenated blood received from the hepatic portal vein in that liver itself. And next liver and mixed blood it will be entered into the ductus venosus, and after entering the ductus venosus it will be entered into the inferior vena cava. From the inferior vena cava the blood received that right atrium. When will be enter into the right atriums, there in that it's getting deoxygenated blood from the superior vena cava also receive that deoxygenated blood to the right atriums. When you will be enter into the right atrium to the blood, in the blood that blood it's divided into two parts. two places, that is right ventricle and foramen ovale. So in the right ventricle, it's received from right atrium blood also, as well as in that superior vena cava also blood it's received in that both. And next in here right ventricle is receive a little bit, and for most of the blood it's entering into the foramen ovale. After entering the foramen ovale, the left atrium it received the blood. So left atrium again it's getting the blood from the lungs. In that lungs it's receiving that venous blood, that is through the pulmonary vein. Through the pulmonary vein, the venous blood it's receiving the left atrium. So if you're seeing that in the right ventricle receives the superior vena cava blood, and next will be entered into the this pulmonary artery. After entering the pulmonary vein, that is a right ventricle is received that superior vena cava, then it will be receive that pulmonary artery, and then it will be passes the blood it passes through the lungs, bypasses through the pass the lungs and through the pulmonary artery. Then it will be go to the ductus arteriosus. I'll show that images, that fetal circulation. And next in that ductus arteriosus, blood carries. Here it will be carries the blood, then it will be entered into the descending portion of the aortic arch. It will be entered into the descending portion of the aortic arch. In the descending portion of aortic arch only, the descending means it's coming to the down. So if through the descending portion of aortic arch, it will reaches to the body parts. The blood supply to the all over the body and various parts in that lower region of the body. The blood entered into the various parts in the lower region of the body. Then it will be entered into the internal iliac or hypogastric arteries. Then it will be entered into the umbilical arteries. Then it will be reaches to the placenta. So this is the circulations. And next we will see that foramen ovale. In that foramen ovale, the blood entered the foramen ovale. In the from the foramen ovale, it will be entered into the left atrium. From the left atrium, it will be entered the blood into the left ventricle through the mitral valves. So after entering the left ventricle, that will be entered into the aorta. Then from the aorta, it will be divided into two places, and one is the coronary arteries. The coronary arteries will be supplied to the myocardium, and another one place is carotid arteries, and from the carotid arteries, that blood it enter into the tissues of the brain. So this is a process of fetal circulation. If you're seeing this, you can able to understand little bit of this. From the placenta through the umbilical veins, this red color line will be umbilical veins. Through the umbilical veins, it will be entered into the liver. That is umbilical vein will be entered into the liver. Here in the liver, it will be getting that from the portal veins, it is getting the impure blood, and that to the liver. Then it will be entered into the that is a ductus venosus. This is a ductus venosus. After entering the ductus venosus, it will be entered into that right atrium. This is its inferior vena cava. This is inferior vena cava. It will be entered inside of the right atrium. And next, if you are seeing that this is the superior vena cava. This is the superior vena cava. That blood, impure blood, it will be getting to the right ventricle. It will be getting the right ventricle. And next, if in this from the inferior vena cava right atrium it is going on. See, this is going to the foramen ovale. This is the foramen ovale. This is foramen ovale. From through the foramen ovale, it will be go to reaches in there, and next it will be entered inside of the left ventricle also. And to the left ventricle, it will be going to that aorta. This is that aorta, and this is that pulmonary artery. Through that pulmonary artery, it is here left ventricles, it's going to that aorta. From the aorta, it will be going to that brain and heart of tissues, and here in the right ventricle, it's going to the pulmonary arteries. Pulmonary arteries is supplied to the lungs. Here in this aorta and pulmonary artery veins will be there, no? So that aorta and descending of aorta, and the descending of aorta will be having that one joining will be there here in this part. It is the name of the ductus arteriosus. In this place, it's not having that connection. After delivery of the baby, when it's getting the division. Before that, it won't having any division in this part. So this will be descending of aorta. In this descending of aorta, it is the supply of blood and that all over the fetus. And this is height of arch. This is height of arch, the right lung and left lung. This is the fetal circulations images. Now we'll see that after that previously we saw that fetal circulation, how it will be happen in that inside of the uterus. Blood circulation will be present in the baby or fetus. Fetus, not in the baby. After delivery of the fetus, when the baby is coming outside of the womb, then only we can able to say that that is a baby. So now we'll see that extrauterine circulatory change at birth. So after the delivery of the baby, what are the changes will be occur in that circulations, blood circulations, that we'll see now. This first one is the blood and oxygen supply was discontinued while the clamp cord is umbilical cord is clamped. So blood and oxygen supplies, which is it's coming from that placenta, the fetus received blood and oxygen supply, no, that will be discontinued when the umbilical cord is clamped. Then oxygen supply is continue to the newborn's lungs, so the lung expands with air leads to the pulmonary artery, pressure is low and circulations to lungs increase. When it is getting that oxygen supply is continued to the newborn's lungs. After the clamp of the cord, that lungs it start to function. So during the time of fetal life, the lungs it's getting maturation. It's not functioning. It is a fluid-filled lungs. So after the when the baby it's deliver, that time only start to function the lungs. So when it is deliver, when it is start the function of the lungs, that time only the baby cry first time. So in the baby getting the first air, so that time what will be happening, the lungs expand with the air leads to the pulmonary artery, getting pressure is slow and circulation it's low, circulation to the lungs is increase. So pressure is low, so circulation would be a increase. After that, following structure changes occur in newborn and vascular systems. So what are the changes will be occur? Now we'll see that. First one is the closure of the umbilical arteries and closure of the ductus arteriosus, and third one is closure of the umbilical vein, and fourth one is closure of the ductus venosus, and fifth one is closure of foramen ovale. This five changes will be occur during the time of when change the fetal life to baby's life, newborn baby's life. In the fetal circulation, first changes of closure of the fetal circulation is closure of the umbilical arteries, and that functional closure is occur immediately after birth of baby, and then it get completely closed by 2 to 3 months. The functional closure is, that is physiologically functions will be occur, and means that is blood circulation will be stopped immediately after birth of baby. Then it completely closed, means anatomically to be closed. It will take time 2 to 3 months, and then distal distal part form as lateral umbilical ligaments, means that is distal part, umbilical cord end part, umbilical arteries end part, it's formed as a umbilical ligaments. This is a umbilical arteries, it's changed as a umbilical ligaments. And second one is that closure of ductus arteriosus. In that the pulmonary blood flow and arterial accents is increased, and due to vasoconstriction of ductus arteriosus within hours of birth. And the pulmonary blood flow and arterial accents is increased due to the vasoconstriction of ductus arteriosus within hours of birth. After birth of the baby, the pulmonary blood flow will be occur in that increased, and arterial accent also will be increased because of that lungs start to function. So vasoconstriction it's occur in the part of ductus arteriosus. So when it is getting the vasoconstriction, that time the blood supply will be getting low supply, low circulations will be present, but in the pulmonary blood circulation will be having it increased supply of that pulmonary blood supply. So when the lungs will be start to function, that the pulmonary blood circulations will be increased, but in the ductus arteriosus it's getting that constriction be present. And this physiological closures occurs after baby birth. It is initiated the pulmonary respiration. In the physiological closure means that is in that functionally closures will be occur after birth the baby. At the same time it is initiated the pulmonary respirations. When it is getting problem, it will be closure of this ductus arteriosus, that is name of the newborn, it's having the patent ductus arteriosus, that we can say that PDA, patent ductus arteriosus. And these anatomic closures occurs while the growth of fibrous tissues by 1 to 3 months. Their anatomic closures occurs while the growth of fibrous tissues by 1 to 3 months it is taken. Physiologically it occur in that after immediate of a birth, but anatomic closures it will take the ductus arteriosus, it will take in 1 to 3 months. And ductus arteriosus then becomes ligamentum arteriosum. The ductus arteriosus, it becomes name of that ligamentum arteriosum. Then third one is it's a closure of umbilical vein. The closure of umbilical vein, the umbilical vein form the ligamentum tears. The umbilical vein form as a ligamentum tears. The umbilical cord functionally it's closed. Umbilical vein is functionally it's closed when they clamp the umbilical cord. So umbilical vein it's closed. It's when they clamp the cord in the part of that when it is coming from the placenta to fetus. That time we have to clamp the cord when the baby birth. That time it will be functionally stop the blood supply to the from placenta to fetus. And next go for that closure of ductus venosus. That if the umbilical cord blood flow is decreased, the ductus venosus blood flow also low, and it constructs in 3 to 7 days. When it is getting that umbilical vein supply or umbilical artery blood supply, when it is getting low because of clamping the umbilical cord, so it is leads to that because of this decreased blood supply to that ductus venosus also. So if it is coming to that decreased blood supply to the ductus venosus, it's getting to start the construction. It is construction start in the 3 to 7 days. It becomes ligamentum venosum. It's formed as a ligamentum venosum. Means ductus venosus is formed as a ligamentum venosum. And fifth one is that closure of foramen ovale. So this foramen ovale will present in between the atrium, means right atrium and left atrium. In between that foramen, and the foramen will be present in the between the atrial. So in that foramen ovale, when the decreased supply of ductus venosus and increased pressure and blood supply in pulmonary artery leads to left ventricular and left atrial pressure is increased. When its blood supply is decreased in the from the ductus venosus, means from the umbilical veins getting that low blood supply, and ductus venosus also it's a decreased blood supply. So in that time left atrium it's getting low blood supply, but in that right atrium it's having that pressure and lungs pulmonary circulations pressure will be increased. So if it is getting that left atrium increased pressure, right atrium it's having the less pressure, so center of that foramen ovale it gets in closure of this. So functionality closure occur after birth of baby. When it is getting crying, first cry, that time it's going to functionally closure will be occur. And anatomical closure occur by 12 months. It becomes fossa ovalis. Anatomically it will be closure occurs by the 12th months. The name it becomes as a fossa ovalis. Becomes as a, the foramen ovale becomes as a fossa ovalis. This is the fetal circulations explanations. Thank you. வாழ்க வளமுடன்.